All right, and it is right at 3:01, so I will get started. Hello, everyone. My name is Michelle Putnam, and I would like to welcome you to today's CDC Partner Update call on COVID-19. This call serves as a way for CDC to share weekly updates on COVID-19 and our latest resources and guidance. Today's call will focus on CDC's guidance for schools. First, we will hear from one of our COVID-19 medical officers supporting the Chief Medical Officer for the COVID-19 response, and he will describe where we are with the response and give us insight into recent scientific findings. Then we will hear from a CDC scientist who was pivotal in developing guidance focused on new school tools for a healthy new year. Afterwards, our speakers will stick around and answer some questions we received over the last week via email. If you experience technical difficulties or otherwise would like to review today's call, you can find the recording on cdc.gov and YouTube in 8 to 10 days. All past partner calls can be found there, so please take time to review and share prior recordings. If this is your first webinar with us, welcome. These calls occur every Monday at 3 p.m. Eastern. Please see the link on the slide to subscribe and receive future call invitations. Please note this call is not intended for media, although we do welcome any media who may be here today. And should media have any questions, we invite you to reach out to media@cdc.gov. Also, we'll have 2 short polls through the webinar, one now that some of you may have already taken, and another at the end of the presentations to get feedback about the effectiveness of these calls. Please answer the one now on your screen if you haven't already, and you'll see another one before we start the Q&A section. These calls are designed to share the latest science, guidance, and resources from CDC's website. There are over 2,000 documents providing information and guidance for individuals, businesses, and the public on cdc.gov. In addition to the resources we'll discuss today, please check out these recent web additions. Heading into the new year and a new phase of the school year, we first wanted to share a helpful one-page document on protecting your school against COVID-19 and the 6 steps you can take to properly clean and disinfect your school. Another resource is the recently updated page on information for school nurses and other healthcare personnel working in schools and childcare settings. This page provides information for school nurses around evaluating children for symptoms or exposures, implementing mitigation strategies, assisting with contact tracing and testing, and supporting students, family, and staff, among other topics, including, and very importantly, self-care. Finally, I'd also like to mention a new morbidity and mortality weekly report from December 4th titled Summary of Guidance for Public Health Strategies to Address High Levels of Community Transmission of COVID-19 and Related Deaths. That is a mouthful, but this report is incredibly helpful. It outlines a combination of 10 evidence-based strategies that every one of us can use to slow and ultimately stop the spread of COVID-19. I encourage you to check out the Science Update and MMWR pages when you have a few minutes. There's always something interesting to learn there. I am pleased today to be joined by 3 CDC experts on the COVID-19 response. Dr. Cliff McDonald is a medical officer serving in support of the Chief Medical Officer for the CDC COVID-19 emergency response. Dr. Sauber-Schatz is the lead for the Community Interventions and Critical Populations Task Force on the CDC COVID-19 emergency response, as well as the lead for the Mitigation and Risk Working Group in the Joint Coordination Center for the CDC COVID-19 emergency response. And Dr. John T. Brooks is Chief Medical Officer for the CDC COVID-19 emergency response. Now I'll turn it over to Dr. McDonald for some updates.
Thank you, Michelle, and welcome to everyone joining us today. As mentioned, my name is Dr. Cliff McDonald. I am a medical officer who's serving in support of the Chief Medical Officer, that is John Brooks, who you'll hear from later for the response. Today, I'd like to provide a brief update on the response and review some of the latest scientific developments. First, a situational update on cases and deaths. You can see from the slide that both cases and deaths are increasing. One important stat here is that the weekly average of cases over the past 7 days is 18% greater than the previous week's average. This is a significant weekly increase in case counts and has been sustained and compounding over the past few weeks. Since 2 months ago, on October 5th, when cases were nearly 43,000 per day, cases have increased 338% to about 188,500 per day. It should also be noted that the weekly average of deaths over the past 7 days has increased drastically, with a 48% increase over the previous week's average. These stats provide us with a very valuable information and unfortunately a grim situation with these percentages. When these percentages are decreasing, this tells us that mitigation efforts are working. When case counts increase, this tells us that we need to step up mitigation efforts to slow the spread of COVID-19. One additional note, 66% of jurisdictions, which include states, territories, and some cities, are in an increasing trajectory for cases. It is also important to note that there is increasing evidence that some racial and ethnic minority groups, particularly Black or African Americans, Hispanic or Latino, and American Indian or Alaska Native people are being disproportionately affected by COVID-19. Inequities in the social determinants of health, such as poverty and healthcare access, affecting these groups are interrelated and influence a wide range of health and quality of life outcomes and risks. We encourage you to visit CDC's data tracker for the latest stats and COVID View for a weekly summary of key indicators for the pandemic. Now, this week, I want to share some of what we've learned recently from 3 reports. 2 of these are published in the COVID-19 Science Update, and 1 in the Morbidity and Mortality Weekly Reports, or MMWR. In the interest of time, I'll only briefly touch on the high points of these reports, and I encourage you to visit cdc.gov to read the full report. The November 17th Science Update, the section entitled COVID-19 and Return to College, highlights measures that colleges and universities can use to mitigate COVID-19 as students and faculty return to campus. The first highlights that testing strategies that included RT-PCR testing for incoming students identified more cases than symptom-based screening alone, though all strategies failed to detect a portion of cases. The second discusses the causal impacts of different modes of teaching on the spread of COVID-19. This study found that in-person teaching resulted in a greater number of county-level infections than either fully online or hybrid teaching. See the link for more information. Next, in the October 11th MMWR, Morbidity and Mortality Weekly Report, there's a report on a study about the implementation of a pooled surveillance testing program among asymptomatic COVID-19 infections on a college campus in North Carolina during the fall semester. From previous studies, we know that COVID-19 can spread rapidly through university settings, and that pooled testing can enable large-scale testing while minimizing the needed resources. At this university, over 10,000 students were tested, a total of almost 69,000 times. 84 had positive results. Of these positive infections, half were asymptomatic, meaning they showed no signs or symptoms for COVID-19. The results from this study show that by combining prevention strategies like social distancing and wearing masks with frequent testing, individuals can be identified who are asymptomatic and yet infected and potentially spreading the disease. This can limit the spread of COVID-19 in congregate settings like schools. Again, check the link for further details. Finally, the October 30th Science Update, the epidemiology section, describes a peer-reviewed study on the transmission of COVID-19 in children aged 0 to 19 in child care facilities and schools after their reopening during May, back in May in Germany. Of 453 COVID-19 cases among children 0 to 9 years old, only 137 attended school during their entire infectious period. From these 137 cases that attended school, 6 cases resulted in infection of 11 additional students, while 4 other students were infected by 2 teachers. Importantly, this study demonstrates that child-to-child transmission in schools and childcare facilities was not common and was not the primary cause of COVID-19 infection in children. This study also shows that as we gradually return to the regular school and childcare facility life, strict prevention strategies such as mask wearing by whomever possible. Again, children under 2 years of age, it's not recommended, but mask wearing by all other individuals at all times, and improved ventilation are crucial to mitigating the spread of COVID-19 and lower the spread of cases. Finally, before we move to today's speakers, I'd like to remind everyone that the flu season is here. It still is here and will be with us for the coming months. So with rare exceptions, the CDC recommends annual flu vaccination for everyone 6 months of age or older. I encourage everyone on the call to get your flu shot and to support flu vaccination efforts within your organizations. Now is a great time to get the flu vaccine. With that, it is now my pleasure to hand you over to my colleague, Dr. Erin Sauber-Schatz.
Great, thank you, Dr. McDonald. Hello, everyone. My name is Erin Sauber-Schatz, and I'm the lead of CDC's COVID-19 Emergency Response, Community Interventions and Critical Populations Task Force, and the lead of the JCC Mitigation and Risk Working Group. This is just the disclaimer for the presentation today. Next slide, please. Great, and today I'm just going to go over some data and statistics as well as highlight some of the new tools and resources that the CDC has put out for K-12 schools and highlight a few other topics related to K-12 schools. Next slide, please. From early March until mid-September 2020, there was an MMWR that came out that reported that more than 250,000 school-aged children aged 5 through 17 had tested positive for COVID-19, and that the rate of confirmed COVID-19 cases among adolescents aged 12 through 17 years old was approximately twice that of younger children aged 5 through 11. The amount of testing and percent of positive tests among children aged 5 through 17 varied over time and by region. According to CDC's COVID data tracker, as of yesterday, the number of children aged 5 through 17 with COVID-19 has increased to 882,371. We know that COVID-19 in children can cause severe outcomes, including hospitalization, ICU admission, and even death. At least one underlying health condition was reported from approximately 1 out of 6 children admitted to the hospital reported in this MMWR, and Hispanic and Black children were also more commonly reported among those hospitalized. For awareness, we are working on an update and an expansion of this report, and we hope to have it released by the end of next week. There are also several other school and child-related pieces coming out this week and next, so please just keep an eye out for them. It is important to reiterate that success in preventing the introduction and subsequent transmission of SARS-CoV-2 in schools is connected to and dependent upon preventing transmission in communities. Therefore, it's important that schools and communities implement and adhere to multiple mitigation strategies and adjust mitigation strategies as needed to reduce COVID-19 disease risk for students, teachers, school staff, families, and the community. Another MMWR article released last month about the transmission of SARS-CoV-2 infections in households in Tennessee and Wisconsin between April and September 2020 suggests that transmission of SARS-CoV-2 within households is high, occurs quickly, and can originate from both children and adults. Therefore, prompt adoption of disease control measures, including self-isolation at home, appropriate self-quarantine of household contacts, and all household members wearing a mask in shared spaces can reduce the probability of household transmission. Not shown on this slide, there was a paper just released at the end of last week titled Symptoms and Transmission of SARS-CoV-2 Among Children, Utah and Wisconsin, March through May 2020. Rebecca L. Laws is the primary author, and it was just released in Pediatrics. So if you'd like to look that one up, that's another new study that just came out. Next slide, please. Great. So CDC has developed a variety of tools and resources for K-12 schools throughout this year. Those include things such as our considerations for K-12 schools, readiness and planning tool, interim guidance for administrators and U.S. K-12 schools and childcare programs, preparing K-12 school administrators for a safe return to school, and most recently in mid-September, we released indicators to help schools make ongoing decisions about in-person learning as local conditions evolve through the pandemic. When coupled with local data about community spread, these indicators are an important tool that can help local officials, health officials, school administrators, and communities to prepare, plan, and respond to COVID-19. So based on our experience providing technical assistance to schools, states, and localities and discussions with partners, we continue to identify and create tools and resources to help schools open safely and help protect students, teachers, and staff from COVID-19. Today, I will be sharing 2 new tools that were created to help school districts, administrators safely resume in-person learning. The tools are based on our existing resources and recommendations, and they are meant to be actionable and user-friendly. The tools I'll be covering today are listed on this slide, and you can see there are several, so let's keep going. Next slide, please. The first one that I'll be talking about is the K-12 School COVID-19 Mitigation Toolkit. It breaks down CDC guidance into actionable checklists to help administrators consider different COVID-19 mitigation strategies to implement in their schools. After completing an at-a-glance table to identify which strategies are already in place and which need more focus, school administrators can navigate to 6 easy-to-use checklists that correspond with key mitigation strategies. A preview of these checklists is displayed on the right. This toolkit also guides users through policies and practices to protect specific school staff, as well as how to apply the hierarchy of controls to select feasible and effective COVID-19 mitigation strategies when resources are limited. Once administrators complete the checklists in the K-12 School Mitigation Toolkit, they can use the next tool called the Getting Schools Ready tool. Next slide, please. After reviewing the K-12 School COVID-19 Mitigation Toolkit, the Getting Schools Ready tool can be used to plan and execute a school walkthrough with local health officials. In the summer, we were spending a lot of time providing TA and even doing virtual walkthroughs for individual schools. So we wanted to bring this level of TA to everyone. So we created this walkthrough tool and technical assistance document. Through the 5-step process outlined in the tool, school administrators and health officials work together to consider whether mitigation strategies from the K-12 School Mitigation Toolkit have been effectively applied to various physical spaces and facilities within a school. This includes places such as the main entrance and exits, gymnasiums, cafeterias, and classrooms. Additional resources are embedded throughout the tool to further support school administrators through each step of the process. We hope these tools can help prepare schools for a healthy new year and a safe return to in-person learning. CDC has also released the What Do I Do series. This is a series of 3 posters shown here that guide school nurses, teachers, and parents through steps to take if a child is showing COVID-19 symptoms at school. Recommendations are based on CDC's considerations for operating K-12 schools during COVID-19, but tailor information about preparing for when someone is sick to these 3 key audiences. These posters are located in the printable posters and graphics section of the school and childcare homepage and are intended to help school communities be better prepared to respond to potential COVID-19 cases in the spring semester. CDC has also released additional tools for teachers and school staff to safely and effectively clean and disinfect schools. Additionally, we have provided a checklist to help teachers clean and disinfect their classroom. These are new printable resources for teachers and school staff. They are aligned with EPA cleaning and disinfecting steps. They're available in both English and Spanish, and the toolkit includes 6 steps to clean and disinfect your school, and then for teachers, tips on cleaning and disinfecting classrooms. There are also 12 printable posters and classroom checklists that incorporate visuals and are, as I mentioned, available in both English and Spanish. As schools continue to assess whether to reopen for in-person instruction, it's important to have systems in place for monitoring and evaluating COVID-19 mitigation strategies. To help meet this need, we created several monitoring and evaluation tools and resources, including the checklist for monitoring and evaluating for K-12 schools, which includes steps to develop a useful and feasible monitoring and evaluation plan, an interview guide that helps to understand individual perceptions and experiences with mitigation strategies in K-12 schools, and a focus group guide to learn about perceptions and experiences with mitigation strategies from small groups. Next slide, please. The M&E checklist is intended to help the user adapt monitoring and evaluation approaches for local situations and the mitigation strategies that may be implemented in K-12 schools in each community. The checklist contains fundamental information to support development of a useful and feasible monitoring and evaluation plan. It's not an exhaustive list, but rather includes key considerations that address how to determine the scope of a monitoring and evaluation plan, develop an evaluation design for the monitoring and evaluation plan, identify key indicators and data sources, and determine how findings may be shared for timely decision-making and transparency. Next slide, please. We have even created interview and focus group guides for professionals in public health or education who are interested in exploring local perceptions and experiences of mitigation strategies in order to inform planning and implementation. The interview guide is meant to be adaptive for local context. It's meant to help the interviewer obtain more in-depth information about perceptions and experiences of mitigation strategies used to reduce the spread of COVID-19 when schools are open for in-person learning. Potential interviewees could include school or school district administrators, school facilities and staff, school-aged children or parents and guardians of school-aged children, and interviews can be conducted by phone, virtually, or in person. As with the of course, if it's in person, we want to ensure appropriate COVID-19 prevention strategies are in place though. As with the interview guide, the focus group guide contains sections that are adaptable to the local contexts. However, rather than individual interviews, the focus group guide will help government professionals learn about perceptions and experiences with mitigation strategies from small groups. Now I'm going to move on I would like to take the opportunity to share a couple additional items that are related to K-12 for your awareness, since I've covered some of our new tools in detail. Next slide, please. Thank you. As of last month, there's a new information page for school nurses and other healthcare professionals working in schools and childcare setting. The web page lives with the other school and childcare content and pulls information and resources from across the Response website into a single space for school healthcare professionals as a reference. We know that we have lots of resources out there, and so we're trying to pull them into these sorts of pages where it's a one-stop shop for specific audiences, and in this case, school nurses. It includes sections in the web page including quarantine, isolation, symptom screening, and testing for children, infection prevention recommendations for school nurses and other healthcare providers, and self-care for nurses and other healthcare personnel. I also wanted to bring up updates to our considerations for wearing masks. On November 12th, CDC's COVID-19 emergency response published updates to our considerations for wearing masks. The updates included expanded guidance on new and different types of masks, including clear masks or cloth masks with clear panels, which are particularly helpful for people interacting with those who are hard of hearing or people with disabilities. We also provide expanded explanation of mask adaptations and alterations to specifically address considerations for children and people with certain underlying medical conditions. The page also now includes a statement that masks offer some protection to the wearer to align with the recently released scientific brief of masks, and also clarifies that wearing a mask does not raise the carbon dioxide level in the air you breathe. Finally, the illustrative graphics on the page clearly show different types of appropriate masks, as well as examples of masks that offer less protection. These pages are also getting an update that is moving through now to include some considerations for cold weather. So watch for those in the near future as well. So in conclusion, the tools that we have created are intended for district administrators and other school personnel in order to use to help protect students, teachers, and staff from COVID-19 infection and slow the spread of COVID-19. Of course, we have tools also available for parents and teachers, in addition to these new school tools that are focused in on those administrators. But this set of tools is meant to assist school administrators who have already made the decision to reopen their schools partially or fully, or for school administrators looking for additional guidance to ensure that their policies and practices follow the best guidance to reduce the spread of COVID-19 in schools. These new tools are meant to be used together and can guide school leaders through the process of planning and selecting COVID-19 mitigation strategies, monitoring and evaluating the implementation of select mitigation strategies, and reinforcing the implementation of mitigation strategies in schools. CDC's considerations, resources, and tools are meant to supplement, not replace, any state, local, territorial, or tribal health and safety laws, rules, and regulations with which schools must comply. We sincerely hope that these tools help prepare schools for a healthy new year and a safe return to in-person learning. That is all for me. Thank you.
Thank you, Dr. Sauber-Schatz, and thank you, Dr. McDonald, for the update at the top of the call. That was a lot of good information, wonderful information to absorb and take with us through the question and answer period. And I want to kick it off, I think. Well, actually, first, I want to kick it off with you all answering a couple of questions for us. We will have a question and answer period, but before we get started on that, we want you to answer a couple of questions for us by taking the poll that you see on your screen now. So go ahead and take that. And then we received a great mini question in advance to the call today, and we will get to as many of those as we can in this next half hour. And I will start off with a question for you, Dr. Brooks, our first question. And it's a question about their recent change in quarantine guidance. And they ask, is it true that CDC's guidance for quarantine has changed from 14 days to 7?
Hi, first, can you hear me okay? I want to make sure you got me.
Yes, we can.
All right, Michelle, thank you. Well, listen, first of all, I want to thank you and Cliff and Aaron for this lovely presentation. It's a lot of information to absorb. And on top of that, we have this new information about quarantine. So let me answer this question for folks. First, I'm glad you asked it because we want to make sure people are very clear. As we learn more about the virus that causes COVID-19, we're continuing to refine our guidance to reduce transmission. And since the start of the pandemic, CDC's recommended that if you've been exposed to someone with COVID-19, you need to quarantine for 14 days after the exposure. So you've been exposed, we don't know if you have infection yet, but you need to stay away for 14 days. Because quarantine helps prevent the spread of disease that can occur before a person knows they have the virus. I mean, CDC still recommends quarantine for 14 days as the best way to reduce the risk. But after reviewing some new research and data, CDC's identified 2 acceptable alternative quarantine periods that we announced last week. These options include quarantine that can end at 10 days without a COVID test if the person has reported no symptoms during quarantine every day, or 7 days but with a negative viral test, and again, if the person has reported no symptoms during the period they were in quarantine up until then. We are sharing these options with our public health agencies and partners so they can determine how long quarantine periods should last in their communities over which they have jurisdiction for setting these regulations. And they can make these decisions based on local conditions and resources. So everyone should just be aware you need to follow the specific recommendation from your local health department about how long quarantine may last in that jurisdiction.
That is very helpful, Dr. Brooks. Thank you. And I'll switch gears for a moment and turn to Dr. Sauber-Schatz. We received several questions about fevers and when to send students home. And we have one person that wondered, for their specific school setting, should they require children to stay out for 24, 48, or 72 hours if a fever does come on in a student? Early on, they had received guidance for 72 hours, but they're not sure if that's still the recommendation.
Yeah, thanks, Michelle. So schools should base decisions about when it's safe for students who develop symptoms to be around others and return to in-person school on the responses to the school symptom screening flow chart. So a symptomatic student with no increased risk of exposure to the virus that causes COVID-19, SARS-CoV-2, should stay home until his or her symptoms have improved according to the existing school policies. This is typically at least 24 hours after a child no longer has a fever, which is often defined as temperature of 100.4 or higher, or also that they no longer have any signs of fever. This could include chills, feeling very warm, flushed appearance, or sweating, without the use of fever-reducing medicines. Caregivers of symptomatic students should be encouraged to consult their child's healthcare provider to determine when COVID-19 testing is appropriate. The links in the chat have templates and flowcharts with different scenarios to help assist with questions similar to this one.
Great. Thank you very much for that, Dr. Sauber-Schatz. And I actually have another one on fevers that I will go to Dr. Brooks for. So we received a question that asks, is there a reason to consider temperatures lower than 100.4 as concerns requiring a child to be picked up or not attend school? They've used numbers kind of in the 99s range during the pandemic, but they've mostly, read that 100.4 is the one that they see most often referenced.
Yeah, Michelle, that's a great question. I mean, officially, in many different guidelines, including ours, a fever is been defined as 100.4 degrees Fahrenheit or 38 degrees centigrade. And I'll note here that people with COVID do have a really wide range of symptoms reported. It's remarkable, ranging from very mild symptoms to like a clogged nose or a mild headache or some fatigue or aches to very severe illness that we've all heard about. Symptoms can appear anytime from 2 to 14 days after the exposure to the virus. So it can be up to 2 weeks later. And people with these symptoms may have COVID-19. Symptoms that are particularly indicative are fever and chills, cough, shortness of breath, or difficulty breathing. Also fatigue, sore throat, congestion or runny nose, headaches, and importantly, a change or loss in smell or taste. I just want to highlight that again, that when this virus is, if you're in a place where this virus is circulating and a person loses or has a change in their sense of smell in particular, that's a pretty good indicator that it's likely COVID and not something else.
That is very helpful, Dr. Brooks, especially considering the whole instead of just kind of working with a lot of contextual factors, I think is important for people. That was very helpful. Thank you. And I have another one that I will kind of ping pong back to Dr. Sauber-Schatz. We've got another one on fevers and sending students home. I think there's a lot of questions out there around this topic. If a child showing a temperature needs to go home, should we also ask that siblings stay home as well if they're staying in the same household?
Yeah, thanks, Michelle. This is, as Dr. Brooks just highlighted, the symptomatology of COVID-19 really does raise a lot of questions. But many of the symptoms of COVID-19, such as fever or cough, are also symptoms of common illnesses like cold and flu. So this really does make it challenging for schools to make decisions about when to send children home and for how long, and whether siblings or other close contacts should also be sent home. So schools can work with district and health officials to determine an approach that makes sense based on COVID-19 transmission and infection in their local community. CDC recommends that schools send close contacts of confirmed COVID-19 cases home for a 14-day quarantine, or with working with the local health department based on the updated quarantine guidance that Dr. Brooks just highlighted. So if a student is symptomatic but doesn't have a confirmed or suspected case of COVID-19 due to an exposure, then CDC does not recommend sending close contacts such as a sibling home. So the symptomatic student should stay home until they are asymptomatic for at least 24 hours. We do have additional scenarios related to students presenting COVID-19 symptoms at school, as well as parents, teachers, and administrators on our CDC screening K-12 students for symptoms of COVID-19 webpage. I would pause and see if Dr. Brooks has anything he'd like to add to that response, though.
No, I just wanted to say I think both Dr. Sauber-Schatz and I recognize that this is a tough nut to crack when you're dealing with a disease that has so many different presentations, and particularly when you're in an area where there are other conditions occurring. So it's not there's really sadly no real easy answer. We rely on a lot of people's good judgment to help inform what the best decision is here.
Yeah, thank you both. I would agree with you. And I think a lot of us, or at least myself on the call and others listening in, will continuously kind of refer to some of the links that you mentioned. And Dr. Sauber-Schatz, you just mentioned the additional scenarios that are related to students presenting COVID-19 symptoms at schools. And I think that's something that, you know, you bookmark it and you kind of go back to it and go back to it, not only for updated guidance and updated resource, but just to kind of ingrain it in your own heads. So you're right, it is a tough nut to crack. Let's see, I think that's the last of our fever questions for a moment, and I'll shift gears on the topic and ask Dr. Sauber-Schatz. I have a question around coming from, let's see, a teacher. After a student has confirmed positive for COVID-19 test, after they have a confirmed positive COVID-19 test with isolation requirements that have been met and their symptoms have been resolved, how long should that student be considered non-contagious for COVID-19 and not excluded from school if the student presents with new COVID-19 symptoms?
Sure, I had to find my mute button. John, did you want to start with this one with the updated quarantine guidance?
Sure. So this is a situation though where the kid's, you know, a kid who's been diagnosed. And so in that case, you know, a person who's been diagnosed, they got to isolate. That's 10 days with 24 hours without fever. If it's after a 14-day quarantine, right, and the student comes back, I guess I'm trying to just make sure I understand maybe Michelle, you could clarify the question again for me. I just want to make sure I understand exactly what the situation is here.
Yeah, I think this is another one of those scenario ones that we'll have to kind of revisit. And I know each scenario can be so different based on the context that you all cited earlier on what's going on in a community. I think this one's trying to get at if, let's say, a student does have a confirmed diagnosis for COVID-19 and they've met kind of the 14-day quarantine, or the, you know, depending on how long the local health department has said the quarantine period should last, they've met those requirements. They've come back to school. He's considered, you know, he or she's considered non-contagious. But then what if, you know, 7 days from now, or, you know, 8 days, the same student starts presenting again with COVID-19 symptoms? Do they do the whole cycle again?
Yep, nope, I can answer this. Great, yeah. I know now I know where my confusion was. There's a little bit of mixing up the difference between isolation, which is what we do for people who have got the infection. We isolate them so we know they're shedding infectious virus. We isolate them so they don't share it with others, versus quarantine, which is when we ask someone to set themselves aside, even though they may feel healthy, because they've been exposed. And we use quarantine to protect other people from exposure to that person in the event that the person in quarantine actually was infected and becomes infectious to others before they know it. In this circumstance, if the person has a confirmed COVID-19 test, that child needs isolation for 10 days. That's a child who's got the infection. And we know that by the end of 10 days, and as long as there have been 24 hours of no fever and resolving symptoms, the vast majority of persons like that, children and adults, are no longer shedding infectious virus, and they may then end the isolation. Once you've been infected with COVID, and this is where the next part of the question comes in, once you've been infected with COVID, the best available data suggests that for at least the next 90 days, very unlikely to become reinfected. Now, I want to be careful. I don't want to say that you're not infectious or that you're immune or you're protected, but we have a lot of data that show that a positive test in a person during that first 90 days is picking up residual parts of the virus. It's detecting dead virus that the person's still clearing out of their system. So if a kid is recovered, comes back to school, and then 7 days later, let's say, develops a new cough, very unlikely COVID. In fact, we don't recommend testing and therefore quarantining a child or isolating a child if they were exposed and had recovered. We don't recommend doing anything for them because at least for that first 90 days, all the data say it's not very, very unlikely going to be COVID. And that's where you want to really keep your antennae up to think about what else is circulating. Could this be flu? Or one of the other viral cruds that seem to circulate every winter.
That is a very helpful, Dr. Brooks. I think you've answered probably like 5 or 6 residual questions I had in my own mind with that one. So thank you so much for walking us through it. I think that will help a lot of people on the phone. And again, you brought up something incredibly helpful, like picking up on community context, and, you know, other symptoms could also be indicative of something not COVID that you might also want to take care of. So thank you for that. That was really, really helpful. And I will give you a break and turn it over to Dr. Sauber-Schatz for this next one. And we've gotten this a lot from people, but it's kind of summarized as asking, is school a source of infection? I think people have seen, you know, research papers or studies, and this is just kind of a general thought that's always out there and a question that we always get.
Yeah, thanks, Michelle. So as people are aware, SARS-CoV-2, which is the virus that causes COVID-19, can cause symptomatic illness as well as asymptomatic infection among young and healthy populations. So K through 12 schools could be a potential source of COVID-19 outbreaks due to the number of individuals intermingling in close proximity for extended periods of time. However, schools also serve as an environment that is able to be controlled. So schools can put in mitigation strategies and policies and procedures to help put those things in place that we know work, such as wearing a mask, watching your distance, washing your hands, additional cleaning and disinfection. And so when thinking about all the places that you could go to and potentially be exposed to COVID-19, schools really are an environment that has the opportunity to put all of those mitigation strategies in place. So CDC's operating schools during COVID-19 are considerations, provides information to assist K through 12 school administrators in preparing and planning mitigation strategies most appropriate for their current situation to minimize risk and maintain a healthy environment. So this guidance suggests that when a confirmed case has been on campus or within a school facility, that regardless of community transmission, the K through 12 school should coordinate with public health officials to determine the next steps in communication with students, staff, and teachers, and decide whether the cancellation of classes and/or closure of buildings or portions of buildings or facilities is necessary. While many of the basic action steps in planning and response for COVID-19 are consistent for all schools, the structure of each K through 12 school environment will definitely require individual solutions for the protection of students, staff, and teachers, particularly in regard to case investigation and contact tracing. And I would also just like to say that any cases or outbreaks in the school are also connected to cases within the community. So when there are high levels of community transmission outside of the school doesn't exist in its own little bubble. When students, teachers, staff, parents, families are out in the community and interacting, then they're increasing the risk of getting COVID-19 and then bringing it into the school. So I just wanted to reiterate the fact that the safest way to keep student, teachers, and staff safe during the pandemic is to help control community transmission.
That is a wonderful point and a lot of good information that you just gave us, Dr. Sauber-Schatz, and especially schools, you're right, do not operate in a vacuum. And also it's important for them to work with local public health. And it's a whole community effort kind of in doing this. Schools aren't out there on their own. Thank you for that. And let's see, I'll move along in the questions. Dr. Brooks, I have one for you. It's a little bit of a follow-up to the one you answered just before around symptoms after the fact. This question is particularly asking, how long do symptoms such as loss of taste and smell, probably any symptoms really, last after how long do those symptoms last after the person has completed their quarantine and have received a negative test? I think this question is really trying to get at some of the long-term, not only how long symptoms may linger, but even some of the long-term impact.
Yeah, thanks for that question. You know, there have been so many surprises about this virus that, you know, I don't think any of us could have anticipated. And one of them is the developing evidence that some people can have some persistent long-term complications of what has been at this time called post-acute COVID. Now, I'm sure we will eventually develop a term to describe what we're just learning about now, but this isn't just the regular symptoms like the cough and the fever and the fatigue. And by the way, with regard to the loss of sense of smell and sense of taste, for the vast majority of persons, these come back within a couple of weeks. But I do want to say that it's recommended that if you don't recover your sense of smell or taste, if it hasn't started to come back within 2 weeks, you might want to see an ear, nose, and throat doctor, somebody who manages that, because there are some things that they can do. They can formally test to demonstrate that there's some missing smell or missing taste, and then there are things that they can do to try and recapture that. But what we're talking about here are things that linger, and it's really a broad spectrum of things, particularly cough and chest pain and shortness of breath as a first set. Now, in anybody who's recovering from a pneumonia, we expect that it's not exactly a straight line from illness to health. You have good days and bad days, and there will be some days when you're feeling a little punkier than you are the next. Over the span of weeks, you should generally be feeling better. There are some people who aren't having that. They feel just slammed, like run over, just eaten, and no energy, really fatigued. And we're trying to understand what that represents. This is not a figment of anyone's imagination. These are absolutely real problems. And we had a conference last week with NIH on this topic, and a leading infectious disease researcher named Peter Piot, as well as some American citizens who themselves have experienced this. The three of them, kind of explained this, and it's unpleasant. Now, over time, these three people have begun to get better, but there are some potential long-term complications. These appear less common, but they can include damage and dysfunction in the heart and the lungs, as well as prolonged mental health issues like depression and anxiety. It's unknown at this time how many people will experience these complications or how debilitating they will be, and clearly more research is needed. CDC is funding several cohort studies to assess these long-term consequences. There also a description is available on our web pages, both for the general public and healthcare providers. And we hope these studies will help us understand how the disease affects different people over the long term. Most importantly, we want to be able to begin defining it so that we can count it and then learn about it to prevent it.
That's really helpful, Dr. Brooks, and I think it kind of gives some people some peace of mind in a time where we may not always get such peace of mind. So that's actually really helpful around lingering symptoms as well. I think people find that almost a little bit comforting, and of course long-term impacts and continuing to do research on that. We look forward to updated information as we learn it. I will actually keep going with you, Dr. Brooks. I have another one that's kind of the flip side of the coin. We've been talking about symptoms, but now we're going to talk a little bit about asymptomatic people. This person asks if and how asymptomatic people spread the virus. So I'll turn it over to you for that one.
Right. Well, the answer is yes. People without symptoms can spread the virus. And in fact, we think that over 50% of infections, and maybe more, are due to people who are in a period where they don't have symptoms. There are two ways we describe this. There are some people who are asymptomatic, and the potential for asymptomatic transmission, and that means they are infected, but they never develop symptoms. They stay entirely asymptomatic throughout their infection. This is a group that really underscores the importance of applying our prevention practices like social distancing, masking, hand hygiene, because that can help a person who doesn't have any clue potentially, because they're feeling well, they may actually be infected and inadvertently sharing their infection with others. This is also true for people who go on to develop symptoms. We estimate that maybe, it's very vague, we're not sure yet, but maybe 20 to 40, up to 45% of people may not ever have symptoms of illness, particularly younger people. As many of you probably are aware, children often have been described as are prone to have milder disease and can often be infected without symptoms. As you get older, there's fewer of that. More people become symptomatic. But importantly, People are most infectious with this virus. Again, another thing nobody anticipated. People are most infectious with this virus just before their symptoms start. So if a person is going to go on to develop symptoms, by the time they've had them, you can bet they've already been infectious to others for a day or two before that. So again, that's why these protecting yourself, even when you feel well, by masking and distancing and hand hygiene, keep all of us safe.
Good point. Thank you so much, Dr. Brooks, especially for underscoring that last part about kind of constant mitigation measures and why we have them in place. I do have the next question here is for Dr. Sauber-Schatz, and I think it's on the minds of probably everyone on this call, and it's a large question that I've heard again and again. Is it better to open or close schools?
Yeah, thanks, Michelle. I think since the early summer, we've been talking about the risks and the benefits of schools being open or closed or hybrid, et cetera. And really just given the many known and established benefits of in-person learning, reopening schools as safely and as quickly as possible really is a priority. School and local health officials should make decisions about reopening, though, based on available data. This includes level of community transmission and their ability to implement the appropriate mitigation measures in schools to protect students, teachers, administrators, and other staff. Schools should also consider students' risks and well-being when schools are not open. So including any negative impacts of closure on essential school services such as school lunch programs, special education services, after-school programs, and mental health services. In general, the risk of COVID-19 spread in schools is lowest when students and teachers engage in virtual-only classes, of course, as well as virtual-only activities and events. Risk increases when students and teachers return to in-person learning, but can be moderated with the mitigation strategies as we've been mentioning throughout the call: masking, distancing, washing, cleaning, disinfection, but also things such as cohorting, staggering schedules, and making sure that those mitigation strategies are consistent. And as I mentioned earlier, schools are somewhat of a controlled environment. So we've seen some great successes and examples of successes throughout the pandemic in childcare facilities, to name a location. And CDC has put together what's called the Indicators for Dynamic School Decision Making and Operating K-12 Schools During COVID-19. This provides additional recommendations for safely reopening schools. So if you haven't seen that yet, please take a look. And then in addition, we had an MMWR just come out last week, which is a summary of guidance for public health strategies to address high levels of community transmission of SARS-CoV-2 and related deaths. And in this document, we highlight the fact that schools provide numerous benefits beyond education, including programs, social, physical, behavioral, and mental health services. And because of the critical role for all children and the disproportionate impact that school closures can have on those with the least economic means, we've recommended that kindergarten through grade 12 schools should be the last setting to close after all other mitigation measures have been employed and the first to reopen when they can do so safely. So I think we need to all work together to prioritize schools to help kids get back to in-person learning as soon as possible.
That's very helpful. Thank you, Dr. Sauber-Schatz. And you know, you've kind of been talking about schools as a whole, and we've got a lot of resources. I think the next question is really getting at, even at the individual level, what can teachers, students, how can they protect themselves in school from COVID-19?
Yeah, thanks, Michelle. And it really is the things that we have been recommending all along. So protecting yourself by practicing everyday preventive behaviors, wearing a mask, staying at least 6 feet apart from others as much as possible. We do know that the physical environment of some classrooms and the number of kids don't allow for 6 feet, but as far apart as physically or possible is what we recommend. Of course, washing hands frequently, covering coughs and sneezes, and staying home when sick. Teachers and school staff can teach and reinforce these everyday behaviors to reduce the risk of COVID-19 in schools. And in addition, the What Do I Do posters that I talked about earlier on today's call, CDC has developed many free posters, signs, and messages that schools can use to promote the measures that create safer environments for students, teachers, and staff. And then just finally, our considerations for operating schools during COVID-19 offers many more detailed strategies to help reduce the spread of COVID-19 in schools, and our strategies for protecting K-12 school staff from COVID-19 outline special considerations for specific job duties and school facilities.
Thank you, Dr. Sauber-Schatz. And I know you'd probably like to have a little bit of a breather, but I have
okay.
one more question for you that kind of piggybacks on something you were just mentioning about being in school. So this question asks, can you please describe some of the developmental aspects of the guidance for schools by age of child? So you kind of mentioned kindergarten through second grade, and the relative risks of infection in those age brackets for themselves and for teachers. I think this person is really kind of wanting to know take this into account with all of the academic, social, emotional, and family risks that come about when schools are closed for prolonged periods of time. So if you have anything to add around that, please go ahead.
Yeah, sure. Thanks, Michelle. I will just say that the number of children and adolescents with COVID-19, it's as we've seen for all age groups, it's been steadily increasing since early in the pandemic, especially recently. And children, we know, do play a role in community transmission, particularly for the older children. But that being said, we do know the importance of getting kids back to school. Schools provide safe, supportive learning environments for students. They employ teachers and other staff, and enable parents, guardians, and caregivers to get back to work. And schools also help to mitigate health disparities for students and family by providing critical services, as I've already mentioned, the social, physical, behavioral, mental health services. And we know that many families are experiencing new economic and social hardships related to COVID-19 pandemic, and that's when these services become even more critical.
Thank you, Dr. Sauber-Schatz, and I actually will now give you a break, and I'll turn it over to Dr. Brooks I think we'll get through our questions. We'll do the last two here. So Dr. Brooks, I have a question for you that asks, do we need to wear a mask in sports class or gym?
Yeah, a mask should definitely be considered when students are in a sports class. Vigorous exercise in a confined indoor space, that can contribute to transmission of COVID-19. And so, if you're in that space, you want to wear a mask for sure, but ideally, you'd also like to exercise outdoor. Social distancing also helps protect students during recess and in physical education classes, so you can add that on top of the masking. And then, as I mentioned, consider conducting activities in areas with greater ventilation or air exchange. So outdoor if weather permits, but if you can't be outdoors, then at least see what you can do to crack a window, turn on a ceiling fan, or do something to keep the air moving and even reduce the number of people in the indoor space if that's possible. Adaptions and alternatives should be considered whenever possible to increase the feasibility of wearing a mask or to reduce the risk of COVID-19 spreading in those sorts of circumstances.
Thank you, Dr. Brooks. That's very helpful. And for the last question, I'll turn it over to you, Dr. Sauber-Schatz. We have a question that says, I think we got several questions around this as we head into the holidays. And it asks, why is it safe for children to be in in-person school, yet family holiday gatherings are considered unsafe or potential hotspots? And I'll turn that one over to you.
Yeah, sure. Thanks, Michelle. So the COVID-19 pandemic has brought a unique set of challenges to families and schools all across this country, including my own. So many parents, caregivers, and guardians have faced and continue to face difficult choices about how their child's options for schools should be made, such as deciding between in-person and virtual learning. The guidance, resources, and tools offered by CDC are all meant to help minimize the spread of COVID-19 and are meant to supplement, not replace, of course, any federal, state, local, territorial, or tribal health safety laws, rules, and regulations, which schools must comply. But this means that the local condition must be considered in order to make decisions around school reopening. And much of our school guidance weighs the risks and benefits of available education options to help make decisions about the safest school options. Holiday plans that include travel may increase your chance of getting and spreading COVID-19. Postponing travel and staying home is the safest way to protect yourself and others this year. And we know that the COVID-19 pandemic has been stressful and isolating for many people. We know that families are making difficult decisions about how to celebrate the holidays. I personally have canceled my family visits for Thanksgiving and Christmas. So we count ourselves in the people that are making the difficult decisions. So we really encourage everyone to consider how your holiday plans can be modified to reduce the spread of COVID-19 to keep your friends, family, and communities healthy and safe. And that being said, as I said earlier, the community transmission, reducing community transmission helps to protect students, teachers, and staff and makes it safer for them to get back to school in person. So we all have that shared responsibility to help lower the community transmission so kids can get back to school in person.
Thank you, Dr. Sauber-Schatz. That's a great message to end on, I think. And we're right at 4 o'clock, so this concludes our time together today. I want to thank everyone for joining our call today. Our recording will be posted online on CDC's COVID-19 webpage and on YouTube in a few days. Special thanks to Dr. McDonald, who joined at the top of the call, Dr. Sauber-Schatz, and Dr. Brooks for the excellent presentation and the very informative answers to these questions. We really appreciate it. And the subscription link to receive future updates and invitations is listed on the slide here. So thank you again. Please join us next Monday, on Monday, December 14th, when our topic will be 10 truths about COVID-19. And considering the audience that may be on this call, until next time, be well and take care of yourselves and others. Thanks so much, and we'll talk to you soon. Bye.